We're now holding a press briefing for the Carbon County response relative to COVID-19. Welcome to everybody on the phone or on the computers. We'd ask that you guys do mute your audio for right now so we can't hear you talking, other than, of course, Dr. George. We're gonna keep this to 30 minutes with questions at the end. We will unmute you so we can hear you, so you can ask questions.
Muted.
At this time, I'm going to introduce Maggie Karras, the Public Information Officer for the Carbon County Incident Team and Beartooth Billings Clinic.
Good afternoon. I'm a Public Information Officer, as Commissioner Blaine said, for both Beartooth Billings Clinic and the Carbon County COVID-19 Incident Management Team, along with Amy Highfield, who is with Red Lodge Fire Rescue. With us in the audience today are Carbon County Commissioner Scott Blaine leading the meeting. We'll have Commissioner Bill Bullock, representing the Red Lodge District, present.
Unmuted.
Mayor Larson, Bill Larson, the City of Red Lodge. We've got Dr. Bill George via phone, as well as Dave Westwood with Red Lodge City Council. Kirsten Sweet, Clerk, City of Bridger, and other audience members. Present at this meeting are Incident Commanders Tom Coley with Carbon County Disaster and Emergency Services, and Jason Mahoney, the Carbon County Public Health Emergency Preparedness Coordinator. As of March 8th, as of 8 a.m., March 17th, there are no confirmed cases of COVID-19 in Carbon County, Montana, but we are testing. As of 7:22 p.m. Monday, March 16th, there were 2 confirmed cases of COVID-19 in neighboring Yellowstone County. For this press briefing, we will have Commissioner Bullock, Mayor Larson, and Dr. George speak briefly, after which we will open up the floor to questions. With that, I will turn it over to Commissioner Bill Bullock.
Thank you, Maggie. Thank you, Scott. I'll read the news release that's been put out. Specifically, the Carbon County Board of Health, via Public Health Officer William George, MD, and in coordination with the Carbon County COVID-19 Incident Management Team, issued an order effective 5 p.m. Tuesday, March 17th, 2020, that all Carbon County, Montana restaurant, dining, tap rooms, bars, coffee shops, and casinos will be closed. Drive-through delivery or takeout pickup service for food or beverage are not restricted and are allowed under this order. This order will be in effect for 1 week, to be reviewed on a weekly basis. That timeline could change as officials learn more about how widespread COVID-19 is locally, and in coordination with Yellowstone County health officials. According to Dr. George, and I quote, "The team based this difficult decision on consultations with area healthcare providers, review of international data, as well as national disease prevention guidelines. We've given much thought to how this will impact the business owners, employees, community members, and fully understand the depth of the economic impact and inconvenience this order brings." Dr. George continued, and I quote, "We feel this decision offers the best opportunity to reduce the risk of exposure to COVID-19 for community members and visitors. The Carbon County Board of Health, through the Public Health Officer, has the legal duty to protect the citizens from the introduction and spread of communicable diseases." Dr. George emphasized this is a vital step in stopping the spread of COVID-19. I can't emphasize enough how much this board and this body is anguished over this decision. It did not come quickly and it did not come lightly. Going down this road, the Board of the Carbon County Commissioners have adopted Resolution 2020-10, a resolution declaring a Carbon County public health emergency. Whereas an epidemic of the coronavirus, COVID-19, has been classified as a pandemic by the World Health Organization, with confirmed cases within Montana and contiguous states to Montana and counties contiguous to Carbon County. Whereas the preparation for an epidemic of COVID-19 by local health services began on February 27, 2020, incurring costs that have continued to accumulate. And whereas the need for medical services essential to ensure the health, safety, and welfare of residents of the county will be provided by local medical facilities and the Carbon County Public Health. Whereas the county will commit all available resources and will take all possible action to combat and alleviate the situation. Local resources will not be adequate to cope with the situation. Now, therefore, be it resolved by the Carbon County Commissioners that a declaration of a public health emergency is hereby declared pursuant to Section 10-3-402 Montana Code Annotated, because expenditures for response to this pandemic may be beyond the financial capability of the county. Be it further resolved that copies of this resolution be filed with the county clerk and recorder, county assessor, and Montana Disaster and Emergency Services Division in Helena. I'm going to defer and pass my next commentary on to Dr. Bill George, who's joining us via phone. Dr. George?
Thanks, Bill. Thanks, Bill. Can everybody hear me pretty good?
Yes.
Yes.
Okay. And I'm so sorry that I couldn't be there. They've needed extra help here in Billings, and as you can imagine, there's just a lot of things going on. But I tell you, my priority is with Red Lodge and Carbon County. If I could have been there, I would. I did write some thoughts down this morning, so excuse me, I'm going to read these, but I'd be happy to answer any questions. I know there's a lot of questions about how come this business and not that business, or how about testing, and so I'd be happy to answer any of those. But right now, I'm just going to read some thoughts that I have. So, heeding the warnings from our European neighbors and seeing the steep rise of COVID infections in pockets of our country, we had no choice but to create an environment where we have less options to closely interact with each other. Social distancing in small rural communities is perhaps easier because of our absence of daily crowd movements. Unfortunately, our excellent healthcare facilities are more fragile in health emergencies, as we have a limited ability to surge capacity or replace affected healthcare workers. Carbon County residents are passionate about their communities. For a limited time, the affected businesses are scaling back services or closing to make us all safer in this unprecedented time. We can support them and show our appreciation by ordering out often for pickup or delivery. So that's all I have right now. And I don't know when you wanted to have any questions, or?
I think, Dr. George, I think we're going to pass to Mayor Larson for some commentary specific to Red Lodge.
Over the past couple of days, I've been talking to some of the merchants in town, restaurant owners, bar owners, casino owners, and we all realized that there was going to be some restrictions at some time or another. This is no surprise to them. They all seem to take it very well. As I talked to them this morning after they received the Facebook and emails, some of them were instantly closing down. The other ones were making preparations for takeouts, street pickups. And it was unique talking to some of the merchants that they were actually going to shut down also. Some of the retail stores were going to shut down for 2 weeks just on their own. So we thank all the retail people and the merchants in the city of Red Lodge for helping us through this part. And a quick statement, please continue to support our local businesses through delivery, takeout, and other means which still allow for social distancing. Check on your families, friends, and neighbors. Get outside as you are able and enjoy our open spaces. I would like to thank those who have called in to the meeting adhering to the CDC guidelines, and I'll pass that back on to you, Bill.
I'm going to side with Dr. George, and I want to include most specifically that we have other callers on the line in the remaining municipalities within the county. In order to address that, I'd start around the horn, going to the first incorporated municipality to the north, that being Joliet. Anybody from the town of Joliet wish to provide questions or commentary?
He can't hear anything right now, the mayor of Joliet, so defer.
Okay, pass on to the town of Bridger. Does the town of Bridger have any questions or commentary at this time?
We don't have any questions or comments at this time.
Thank you, Kirsten. How about the town of Fromberg? I guess not. Back to then the city of Bear Creek. And nothing there either, it looks like. Anybody else on the line that would wish to provide comments or questions to the mayor, myself, Dr. George? I'm going to take that as a no. Ms. Karas, would you like to reference, are there any?
We could open the questions up to the general audience here. I believe there is a member of the audience that had a question.
I have a few questions for you guys.
Yes, you in the black shirt. Go ahead.
So I noticed that gyms, hotels, and convenience stores aren't on the list. Why have you not closed down other establishments where people congregate?
Dr. George, would you like to weigh in on that?
Sure, and specifically she was asking about hotels and hotels, gym. Yeah, I've gotten questions today about yoga places, gyms, movie theaters, salons. Those, I can't imagine them not being added to the list in the very near future. What we tried to do is kind of stay in step with Yellowstone County and other cities. The way the other cities have rolled this out, they start with the most high-risk areas of, flexing crowds, people traveling to get to certain areas, and those are the restaurants and the bars. So that's kind of how it's rolling out now. But I would imagine in the next few days, weeks, you're going to see all non-essential businesses, and it's probably countrywide, being affected.
I will say that I did go by the convenience stores in Red Lodge that had eating areas in them, and 2 of them actually already had everything shut down and taped off, and the other one had the tables and chairs all up against the wall, so they were way ahead of us on that part of it.
Right. I can tell you, this is even this closing of mass businesses is new to all of us. And, as kind of the days go on and the situation changes and how we approach this problem is going to change. So there is businesses perhaps that we didn't contact that we should have, but eventually in the very near future, everyone will be contacted. I got a phone call from a business this morning, him volunteering. He said, I'm not on the list, but I just want you to know that I'm closing today, so. And that was our local movie theater, so.
So Mayor Larson, I'm glad to hear that we've got businesses that are stepping up to help out with this this emergency, this incident. Red Lodge bases its economy largely on tourism. How do you feel this will impact the city's ability to function?
We need to look at how it's going to affect things like the resort tax. This is normally a real slack time of the season, and by all of us working together and getting this taken care of sooner is better.
So this question is for you, Commissioner Bullock. You said that you have declared a public health emergency in Carbon County. Can you give us a little bit more information about what that means?
So what that declaration does for the county is it releases the emergency funds that have been milled that we currently have on file. By accessing those funds and releasing them, going through them and hopefully not depleting them, but at least accessing them, it opens the door to access, when and if the time should come, some of that greater federal relief funds that hopefully will be coming down the pipe.
Thank you for that. Earlier it was mentioned that there are no cases in Carbon County and that testing is being done in Carbon County. Who is paying for COVID-19 testing and care?
Dr. George, would you like to field that one?
Either Kelly or I can field that. I think the word here in Billings, and that's just really repeating what's been said on television when the CDC group is addressing these similar questions, is that any COVID testing done by the state of Montana, and those are the testings that we're doing at the present time, are all paid for. So there's no cost to patients at all. There does seem to be a cost for commercial testing that we're not running at this time. For example, in LabCorp is a $51 test. But oftentimes it's more expensive than that because it's an evaluation, it's ruling out other viral testing, it's a visit to a provider. So, the $51 isn't really an actual amount. But the testing that we're doing and most places are doing are through the CDC, and the testing is based in Helena, 24-hour turnaround time approximately, depending on when we can get it to Helena. And there's no cost to the patient for that.
Thank you for that information, Dr. George. We've seen a lot of information about this lowering the curve and how by implementing these sorts of restrictions, we can help with the healthcare capacity and prevent an influx of people that might need care for COVID into our healthcare facilities. Ms. Evans, can you comment on what the capacity of our hospital is at this time?
I would like to address that in 2 parts. The capacity to do testing is driven by how many tests are released by the state. And our capacity to do testing at this moment is roughly 25. The eligibility to receive the testing is a screening criteria is performed. That can be done on the phone, and we highly encourage that. If you come to the hospital, we have a special screening area set up, but we would triage you before you enter the building directly. If you meet criteria and a physician agrees and orders the test, then there's a consultation with the state of Montana who concurs, and then the swab is taken and the test is sent to Helena. So capacity for that is completely dependent on the number of tests we have available. And as soon as we have more tests available, we'll be letting the general public know. But the CDC and State Department are holding the position that all tests go through a provider after symptoms, after there's some criteria that's met. So we're not set up either in Carbon County or Yellowstone County to move to a self-referral basis. This all has to be preceded by a screening. Regarding the inpatient capacity, is a patient might present that is in respiratory distress, then they would be taken to an isolation room, proceed with testing, and wait for those results to come back, and they would stay in full isolation during that time. Because of how the new facility was developed and designed, we have capacity to expand our negative pressure rooms to beyond that of the first room that was set up. Beartooth was designed for one room that is set up continuously for negative pressure. Now we have the capacity, and we're moving through that with our HVAC consultants to secure more square footage. Bed size at Beartooth Billings Clinic is 10 acute care beds. We have, throughout the last 48 hours, started ramping back scheduled services that could be delayed, and that has to meet criteria, but for instance, perhaps speech therapy or physical therapy could be delayed during this time period. So we're right now assessing how we would convert those square footage areas to patient care areas. I'd like to remind everyone that regardless of how much bed space we have, or whether we set up a second receiving center, this is all going to be driven by how much staff we have, what our staffing capabilities are, and that's probably the more limiting factor than actual square footage or number of beds. So our hospital staff has been reacting remarkably. They've been, as of today, 100% of the caregivers have been fit tested. We are in fairly good shape for the masks specific to containing and preventing infection of our employees, called N95s. So we're in fairly good shape compared to some of my peers within the state. And the staff is now, they've always been trained on PPE, personal protective equipment, and how to use that, but now we're re-entering a training phase to keep our existing staff safe And I can tell you that at this time, the staff is responding very well, and we're fully staffed at Beartooth Billings Clinic.
Thank you for that. I just have a few more questions, if you don't mind. This one is for you, Commissioner Bullitt. What happens if people don't comply?
So we've been in communication with County Attorney Alex Nixon, have spoken specifically with Carbon County Sheriff Josh McQuillan, who's given the guidance that, one, they're supporting this measure. Again, this is a public safety measure. This is a public health measure. It has to be followed. Sheriff McQuillan referred me to Montana Code annotated 50-1-204, which talks about quarantine and isolation measures. Violation of these measures as put out by the public health officer. In talking with Sheriff McQuillan, these are misdemeanors should they be. They're a citation, and it's $10 to $100 civil fine, but that goes back to the court in the issue. But the sheriff is on board. He has communicated his support of the measure, and we have communicated with legal staff.
Thanks for that. The response that I've seen around the county has been rising up as a community to help support these kind of efforts. And so I think that hopefully we do have the resiliency as a community, but nonetheless, this is going to impact businesses, families, individuals. What comment would you have to them around the impact that they're going to have now that they may be without a paycheck?
Well, I'll start down that road. I mean, we live in a special community where, we have the privilege to be in the place where we are. And we count on our neighbors and our partners in government and our next door neighbor, the neighbor down the road, ranching families, farming families, in-town families, business owners. There's a reliance and interconnectivity with everybody. Everybody's gonna have to lean on one another now more than ever. This is survivable. This is a public health measure. I think we're a strong community. I think we depend on each other. I think that we've proven that time and again, and I think we can do it again. I have complete confidence in my fellow citizens. Everybody that lives here knows what it takes to live here. I think it makes us stronger and more able, and I have complete faith and I have complete hope in my neighbors and fellow citizens that we are going to do the right thing and have a successful outcome.
And I'll go with you on that too, Bill. Please go check on your neighbors, go check on your families. Let's all work together to get through this, and I'm sure that we can. With everybody's cooperation, we can try to reduce the impact of this public health crisis on our communities. So let's all work together and get this done.
I appreciate you guys having this press conference and giving us this information. It's been very helpful. In the future, if we have any questions or would like to find out more information, how can we get that information?
The best place to get it is carbonalert.org, the Facebook page for Carbon Alert, or follow Carbon Alert on Instagram. Bill, I do think we have the Joliet mayor maybe with us now.
Okay.
And I think there was also a daycare worker, maybe specifically, if they have any questions now. They're on now, I think.
So I would defer, we started with Joliet, and if you're there now, I would open the floor to you if you have questions or concern you want to convey. Mr. Mayor?
Hey guys, so yep, I'm here. Can you hear me?
Yep.
Okay, so I've seen around the country where they're imposing curfews and things like that. Is that something that you guys have looked into? Should we be considering anything like that at this point, or is that kind of not something that they would recommend?
Dr. George,
So
are you still there?
Yeah, I am, and I can respond to that. So I've been at quite a few meetings with decision makers, and no one has talked about curfews. Some of the more stricter draconian measures, for example, in Italy, people just don't think that some of that would be possible here, whether it's in our culture or our size of our cities and those kind of things, and just trying to enforce some of these regulations.
I think there was a daycare worker on. Are you still there?
Yes.
Go ahead with Dr. George, please.
I don't have a question other as
suppose I could. We are restricting everything within our power. We're using one entry for our facility. We're in a church, so there are 3 entries. We are limiting our classroom size. We are doing facility wellness checks that have always taken place before this. Proper sanitation is still enforced and just more vigilant than ever. Is there anything else we should be doing?
Daycares are a very difficult service.
We usually follow the Joliet Public School protocol, but we chose to stay open so that we could specifically serve healthcare provider families.
Right. That's right. It's an essential service, especially at a time like this where we need our healthcare providers to work, basically. We will help you be as safe as possible. There isn't a directive at this time to shut down daycare centers. We will work with you. Our team at the county will work with you to try to make it as safe as possible for our community and for your and for the kids at the daycare and staff. It is, you guys probably know this, but for some reason, it's unknown reason, it doesn't seem like children get severely ill from this infection. Now, there are some
they do carry it to the elderly.
Right, that's the point I was making, is that even though they don't get severely ill, they are vectors for transmission of this virus. So it's a very important business that we look at and try to control any possible viral transmission as much as possible, but it's also an essential service that we need to staff our healthcare workers, our clinics, our hospitals. So at this point, we will work with you. We'll give you written guidelines. We're open to support you. I don't know if now's the time to go through all specifics. But we've been talking about daycares. We've been talking about daycares a lot, and we will help you through this.
Okay, thank you.
Okay, I feel like we're like the only sector open still for that service, not just for healthcare professionals, but also we have parents that cannot afford to stay home.
Right. We realize that.
And so what are we doing about that?
Well, right now, we have not closed daycares in Carbon County. There is a chance in the future that non-essential businesses will be closed, other than gas stations and pharmacies and supermarkets, hospitals, those kind of things. That would possibly free up some parents to be with their children. But again, those things are not definitive yet. There's been no plans on that yet. At this point, we just want to make daycares as safe as possible. Limiting numbers if possible, encouraging people to be at home.
We are limiting numbers, and we are limiting who can be in the facility, but we would just like to stay open so we can stay open for those essential people. And it's not just healthcare professionals. It's people that work in our banks and in all different public sectors.
These are all big challenges, and we so appreciate your call, and we will work with you and the others in our county on getting this information out to you and making things work for you. We certainly appreciate what you do. With that, are there any other questions from the media in the room? Alistair?
I was just for the mayor and the sheriff, actually. What provisions are there for policing the towns if this goes beyond 2 weeks?
As far as the city is concerned, it's business as usual. We have full staffing. We are looking at different measures for City Hall, but nothing real drastic right yet. We're doing like everybody else. If you're not feeling well, stay home. And if we need to do any other adjustments at City Hall, we'll do that.
So we're basically the same. Our dispatchers are isolated. We put out a deal for our deputies to, take into consideration how they do their work. The least amount of interaction they can, phone calls, emails. Jail has become an issue, site release when possible, unless it's a violent felony or partner family member assault. Other than that, business as usual for us.
Do you envisage, if this goes on beyond 2 weeks, there being social problems?
We're fully aware that everybody being cooped up is probably going to have some effects in the long term, so we're prepared for that.
Okay. And are the courts staying open still?
The courts are still open. District Court will still be there tomorrow, but they've made different arrangements on hearings.
And so
the attorneys in the courts have been talking about that this morning. We're not transporting anybody right now. The issue we're having now is if we take them out of jail for a court hearing, they're probably not going to get back in. So we're utilizing video arraignment as much as possible.
And down that line of questioning too, Mr. Baker, was so the sheriff's office remains open, justice court will remain open, district court will remain open, county offices will remain open. There may be some scaling back of personnel to smaller size staffing, but the services will still be provided per statute and will remain that way until something else should happen.
I've got a question for you. I didn't really realize it until I guess it was Sunday afternoon. 2020 census is going on even as we speak. I was talking to one of the census workers. I'm wondering if that's an interesting way of passing things along, because if that census worker goes to every different individual in the state or in the area, in the Carbon County area and in the city area. And what was my reason is because I know her personally and I gave her a hug. Uh-oh, I'm in deep trouble now. Dr. George, you'll have to forgive me. But is that something that you might think about?
I don't know, just for the mere fact of that cohesive message of when the information gets out. So in the incident management team through the Carbon Alert website, carbonalert.org, that is the most up-to-date and manageable site. I would hate to saddle all that information on one person or have you as the recipient of that spend your entire afternoon listening to the whole download of that information table. With the advent of technology, we have that capability to push things out faster, more complete, and in more total grand scale of the total message. I think, Brent, it's a splendid idea face to face, but the reality where we are, I think to get the best message out to the most people is to stick to the technology that's available. But thank you.
All right, so that is all the time for questions that we have today. I'm going to turn it back over to Commissioner Scott Blaine. And thank you. We'll get word out about other ways to submit questions to this group in the future.
Thanks, Maggie, and thank you everybody for attending via in person and online. Especially don't forget to check out carbonalert.org, follow on Facebook or Instagram for the most current updates, and thank you everybody for being here. We will now move to our continuity of government portion of this meeting. Bill?
Yeah, carry on. So if you're welcome to stay for, I'm sorry, Bill, go ahead.
No, I'm just going to say thank you very much.
Thank you, Dr. George.